Good afternoon, everyone. Good morning. If there are any yous joining from another time zone, um, we're happy to have you here for another session of our continuing series in decoding data and digital health. And this one is focusing on cybersecurity. Um, Cybersecurity is starting to become a huge challenge across the board. And it's starting to reach the health sector also. So we're seeking to get into this. I'm Ryan DeSantos. As those of you who may have joined before know, I'm a technical officer in digital health here at the Data and Digital Health Unit, helping to support this. So without further ado, I'm going to hand over to my colleague, Karpet Daftian, who is another technical officer and a colleague here in the WHO office. He'll be moderating the session, and he'll be leading the session moving forward from throughout the entire remainder of this 1 hour here. So Karpet, the floor is all yours to take the lead on this. Thank you so much.
Thank you very much, Ryan. Many thanks, and good afternoon again, dear colleagues. I'm sure if you join this webinar, you know that cybersecurity in healthcare is crucial to protect sensitive patient information, to ensure the integrity and availability of critical health systems, and of course, to maintain patient trust. As healthcare organizations increasingly rely on digital technologies, they became prime targets for cybersecurity, cyber attacks that can disrupt operations, compromise patient safety, and lead to significant financial and reputational damages. For this reason, the robust cybersecurity measures are essential to safeguard against the threats, ensure the continuity of healthcare delivery, and of course, be compliant with regulations and regulatory requirements. We are regularly conducting health information system assessments in our member states, and based on our findings, as well as based on increasing demand or request in cybersecurity capacity building, we can see that cybersecurity is becoming an important area to focus while digital health is developing. And at the same time, we are observing lack of awareness and increasing demand for support. Hence, this webinar is organized in the scope of WHO's Digital Health Flagship. And we invited three well-experienced experts in cybersecurity to share about their experience and advices to prevent or overcome cybersecurity issues in healthcare or digital health. And let me now introduce our speakers first. So we have with us Dani Lieberman, who is physicist by training and has hands-on industry experience related to patient privacy and cybersecurity. He has been involved with security and privacy-related areas of work in the highly controlled environment, such as for medical devices, drugs, digital therapeutics, clinical trials, and information systems for about 15 years. He also has intensive experience in implementing cybersecurity audits, and currently as a WHO consultant, also supporting us to develop cybersecurity assessment instrument for digital health. Dear Dani, thank you very much for joining us today. Our next speaker is Jessica Dominguez. Jessica holds double degree in biomedical engineering and law, having specialized in information security and cybersecurity. She is currently the head of the cybersecurity unit at Portuguese Shared Service of Ministry of Health, having previously worked in regulation, supervision, and certification department at the National Cybersecurity Center. In that role, she also assumed the position of chair of the European Working Group at NIS corporate group dedicated to the health sector. Dear Jessica, thank you very much for being with us today. And finally, the third speaker is Prokopios Drakaris, who is cybersecurity expert and deputy data protection officer at the European Union Agency for Cybersecurity, known as ENISA. Prokopios is currently working in the area of data protection engineering, EU data space, the EU cybersecurity competency center, and NIS Directive 2. Before joining ENISA in 2015, he was involved in several EU-funded research projects in the greater area of information security with the Hellenic Ministry of Citizen Protection, and he held teaching assistance positions in higher education institutions. Dear Prokopios, thank you again for being with us. Now, let me quickly also to introduce the suggested format of our webinar before handing over to our speakers. You know, WHO is regularly organizing webinars on different topics of digital health, and we are receiving many feedbacks. And also considering these feedbacks, we were thinking and trying somehow to make this webinar more interesting, interactive, perhaps more memorable, and why not also a little bit fun. So unlike traditional presentation or speaking format, we are suggesting the role-playing format for this webinar, aiming to build the discussion on the commonly observed live scenario of ransomware attack on digital health information system of healthcare facility. A ransomware attack is type of cyber attack where malicious software or ransomware encrypts victim data, making it inaccessible, and then the attacker demands a payment in exchange of the decryption key. The ransomware attacks can come from different vectors or sources, such as phishing emails, when attackers send email with malicious links or attachments, and when users are opening these attachments, the malware is installed, gaining access to the system and compromising the data. Another source of ransom attack are malicious websites, when users or victims visiting compromised or malicious websites, and after that it can trigger the download and installation of the ransomware. As you can assume, the impact of such attack can be significant, starting with data encryption, when critical data, including patient records in digital health systems, is encrypted and inaccessible. It can also lead to operational disruptions when essential systems are locked, causing significant operational disruptions, treatment delays, and potential harm to the patients. Of course, it can lead to financial losses, which includes ransomware payment, recovery expenses, legal fees, or potential regulatory fines. Finally, also this kind of attacks can lead to reputation damage, affecting patients and stakeholders' confidence. So please imagine this kind of situation happening in healthcare center, and cybersecurity experts or our dear speakers are discussing this situation, highlighting the key steps and areas of importance and perspectives in responding to cyber attack, also preventing it. So without further delay, let's see what our experts can advise to handle this kind of situation. So let me ask my first question to Jessica. Let's say in the capacity of Chief Information Security Officer, CISO, dear Jessica, as a Chief Information Security Officer, please, can you let us know what are the immediate steps healthcare organization should take upon discovering a ransomware attack? Thank you in advance, and over to you, Jessica. Thank you.
Okay, thank you very much for the invitation, and thank you very much for the question. So when we have a ransomware attack, the first step is to maintain some calm, because it's very easy to everybody get in panic, and this will not help anything. So the idea in the beginning is to aggregate some people that is needed for develop the next steps. So we need to inform the board. We also need to involve the IT, of course, and also the communication department. So it's very important in the first step to put the relevant people in the same room to identify the different responsibilities and tasks that is needed to implement in that case. Of course, in the IT department, they will disconnect the infected systems. Probably they will block external accesses in order to not affect other systems in the same network or spreading this kind of ransomware attacks for other systems. And also is necessary as a group to assess the impact, because most of the time the IT department don't have a direct sensibility what is the impact that is one system is blocked or is completely off. So this is not an IT issue, is an organization issue. So it's needed that everybody is in the same room to understand what is happening and what are the next tasks and rules. Also, I think it's very important to give internal notification about not only the small group that have the main responsibilities to address, but it's also important to give information to the healthcare professionals or also the citizens. In this case, it's really important to have the communication department aligned, and also, of course, the legal department. But I think this we will talk later. But as a first step, I'm sure that what is needed is to put in the same room the relevant people, to everybody understand what is happening, what is needed to take care of, to analyze the impacts, and of course also understand if is needed to implement some continuing plans, for example, to change the healthcare provision for paper. This can happen. This is a business continuity plan. is changing from digital services to paper. Or if we have backups that we can, in a short period of time, to implement and to continue the services. But with this, we really need to have different people with different backgrounds to give and to analyze what are the impacts, what are and what is needed. Yeah, this is my big recommendation, I think. And what in that position, what I will do as a CISM. Yeah.
Thank you so much, Jessica. Dear Dani, from the perspectives of operational and management response, please, can you let us know how does ransomware attack impact facility or hospital operations, and what are the management's priorities during such event? What would be your recommendations for management, basically? Thank you very much.
Thanks. So the first is to have an IRT. You must have an incident response team, and they should be trained. I'll talk about that in a moment. So the IRT will typically be 3 to 5 people led by the hospital CEO. I'm a very big believer of ownership by the management. In a case like this, the CEO of the hospital should actually be a part or even the leader of the incident response team. This will ensure ownership by management of the event. Second thing, part of the IRT is communication. So Jessica mentioned legal before. So communications means working and communicating with the National Computer Emergency Response Team. Not every country may have a CERT, but many countries now do. There's one in Israel and the US, and most European countries have your national CERT. So first thing you do, pick up the phone and call the national CERT. After that, the IRT will start working, and their first order of business will be to isolate the affected systems, to disconnect from the network, and to be online with the National Computer Emergency Response Team. Assuming that systems are down because of the ransomware attack, then there will be a switch to manual systems. Hospitals should have manual backup. There will be triage of patient care, which means that people who are scheduled for elective procedures, for example, something, say for skin care or for physiotherapy, they should be notified and told not to come in. There should also be part of the response plan should also include coordination with nearby facilities, which means that if you have hospitals that are close to you, they should be notified immediately that that patients will be routed to them when necessary. In terms of communications, I think that there's always this question of how much to disclose and how much not to disclose, but certainly keep the IRT will keep the staff informed about the situation and as it unfolds. Now, my recommendation for management is not to close the barn doors after the horses leave. This is typical response to shut down, close everything. You may not have an other option, but that's certainly the kind of thing that we should be thinking about right now, not today. Now, just to put this in perspective, in Q1 2024, there were over 1,000 ransomware attacks globally, and this went up by 20% in Q2. So there's a lot of attacks happening right now, and this is actually propagated by what's called ransomware as a service. So there are actually several organizations that actually provide, like you have software as a service, you have ransomware as a service. And that means that anybody, I mean, if you and I, Caro, decided to set up a ransomware group, then we could do that. We just sign up for one of the ransomware as a service services. So that's so it starts with being prepared. That means that the IRT will be conducting the first thing, the most important thing is to conduct a threat analysis to understand where are the vulnerabilities, what's affected, how critical it is, how much damage, financial damage you could actually have. The obvious one is after that to start mitigating the key risks. I'll talk about that maybe in a moment, which starts with backups. Many hospitals still have flat networks. That means that you need to have network segmentation in critical areas like intensive care and operating rooms and imaging centers. There are a lot of common problems in hospitals that use Microsoft Windows. They've accepted Windows Server defaults, which is a very bad idea. The IRT should be conducting an attack exercise every 6 months or after a major change. So if you install the major update to your EHR, then that's a good time to run a ransomware attack exercise. It could be that there was some impact to your network configuration. And that's pretty much at a very high level of what you do. That's during the attack. After the attack, then you need to debrief and do a forensic analysis, which means to understand where it came from, what was actually affected in order to improve and to be better the next time around. Now, the assumption is that you do have backups and that you can assure that all the ransomware was removed. Now, this may not be a good assumption. This may be a very bad assumption, because if we take the example of the Hillel Yaffa Hospital in Israel, which was attacked exactly 3 years ago, it took them 6 weeks to recover. I don't have all the information, but I believe that they have a big problem with backups. So it did take them 6 weeks to recover. It cost over $10 million just to recover their systems. There's very few of these attacks actually document publicly how much money they paid for ransom. Some do, some don't, but it's almost never documented how much money is actually paid to these ransomware gangs. Finally, after that, to restore, you do a debrief, you do a recovery process, you improve your systems, harden your procedures and systems, and you continue to provide during the event, to provide support and resources to the staff and the patients. So that's pretty much during and after what needs to be done. But I can't emphasize enough the importance of having the CEO of the hospital involved. This can't be the kind of thing where if I'm the CEO of a hospital, I say it's someone else's problem. It's not someone else's problem, it's my problem.
Thank you so much, Danny. It was really interesting and very clear. And my next question is for Prokopios. Dear Prokopios, from the point of view of technical response and recovery for the security operations, please can you let us know what are the technical steps involved in responding to or recovering from the ransomware attack?
Sure, Karapet, and many thanks for the invitation and the question. So, as the previous speakers highlighted, we need a coordinated approach, and before that, a plan so that we know what are the actions that we should take. Depending on the size of the organizations, some of the roles might coincide, or some of the processes need to be more tailor-made on the size of the organization, the number of people, the number of different networks, so on and so forth. As Jessica highlighted, we first need to assess, contain the damage, then mitigate the attack, and then focus on rebuilding the system and afterwards enhancing our cybersecurity posture. Danny mentioned a lot of the steps that we need to take with regards to containing the damage through the incident response team. What I would like to briefly focus on is the mitigation measures that we should implement, and that they perhaps might go beyond the affected systems. However, they might have an indirect or direct connection. So based on the initial plan, a suggestion that could be made in the plan, assessed, evaluated, perhaps a request to reset all the passwords could be in place, because the ransomware could have found somewhere, somehow, a way into the systems. Installing a SOC or an endpoint detect solution in various systems that, due to an analysis made earlier, we didn't see the need, or we didn't have the resources to implement it. Also, during this analysis phase, determine to what extent the maintenance, so the additional backups, need to be stopped taken, since they are already affected, and establish the point where we consider that backups are secure in order to be restored at an operational phase. So, having assessed the damage, and based on the initial plan that, as Danny said, we need to have also trained on how to execute it. We need to take actions based on the plan and also on the given circumstances. My main message would be that we don't need to look only into the affected systems per se. However, we also need to think of more horizontal actions that need to be taken in order to establish a baseline of security level, as gave an example with the reset of password, and also to identify possible additional threats that have already been induced into our systems, and due to one reason or another, we are still not able to identify them. Many thanks.
Thank you so much, Prokopios. And really, your answers are very complementing each other. And I don't know if everyone also have that kind of feeling that, oh, it seems yes, but I didn't thought about this. This is what I'm thinking when hearing you. Thank you very much. And dear Danny, let me ask you again to comment regarding the impact on patient care. You already touched a little bit on this, but please, can you advise how does ransomware attack affect patient care, and what are the immediate concerns for healthcare providers?
So the impact on patient care will really depend on how ready the hospital is for an attack. So let's say from a scale of 0 to 100, where the hospital is at a stage 0, where they're totally not ready, then chances are, if they're totally not ready and you get hit by a ransomware attack, you can assume that patient care will be directly impacted, which means that if you're not ready, you can't do procedures, you won't have access to your EHR, you won't have the ability to do even the most simple things like nurses and doctors clocking into the time system. So you need to assume in a case like that, that your best defense, if you are honest with yourself and you know you're not ready, is to have other facilities in the area be able to pick up the slack while you're down. You have to assume that if you're at stage 0, you're 100% down. As you move up at the level of readiness, then the amount of downtime, the amount of impact will, of course, decrease as well. So I think that any disaster recovery plan should take into account what's called a threat analysis, which means to understand where you have vulnerabilities, how much your assets are worth, your system assets, your imaging systems, your operating room assets, your outpatient clinics, your departments where patients are being hospitalized. So this kind of thing, which really cannot be done while you're under attack. It needs to be done before you're attacked. But assuming you've done that and you have a prioritized security countermeasure plan, and you can say, well, I'm not ready for this, I'm ready for that, then you can say, well, I already know what I'm going to do. You can say, I shut down the operating theaters and I send patients to other hospitals. Or I keep the operating theaters up because I have emergency systems, generators, and manual backups, but all of the outpatient clinics I shut down and I tell patients not to come in. So there will be that level of response for disaster recovery. That's pretty much what needs to be happen and needs to be a function of a threat analysis that you do today, not the day of the attack.
Thank you very much, Danny. And let me ask a question regarding communication strategies. I would like to ask this to Prokopios. Please, can you let us know how should organizations communicate with patients, staff, and the public during and after attack to minimize its impact and ensure also probably understanding from the community?
Many thanks. Before answering directly to the question, I would like to reiterate, based on some discussion in the chat, the fact that we can never assume that a system is 100% secure. So regardless of all the preparation that we have taken place as a business owner and as an organization, the human factor is always there, and there is a very interesting statistic where almost 90% of security breaches happen due to human error. So in the case of the ransomware, we can assume, let's say, that at some point somebody will misclick or click a link that he or she shouldn't. Or there could be also the aspect of a zero-day vulnerability that was exploited. So there might be cases where factors are outside the reach of the business owner. Now, going to the communication part, and we're not touching upon, I will not touch upon with regards to legal obligations if, for example, we're talking about notification to data subjects according to the GDPR. This is a different subject, as it is a legal obligation. So with regards to communication strategy, we should keep it, we need to balance it between providing information in order to show confidence that and inform that something has happened, we are dealing with it, provide assurance that we know how to deal it, and on the other hand, do not provide information to the attackers or to other malicious users to say that our defenses are currently down, so the door is open. My memory fails me on the exact incident, but I believe it was in the Olympics of the Munich, where the attackers were seeing what was going on from the television, the police movement from the television. So we need to keep this balance. In some cases, it is better to say we have been attacked, it is being contained, we are currently analyzing it. However, all patients are safe, so provide the realistic situation together with the assurance and continue with the process of assessing recovery while also providing regular communication updates. Currently, since we are in the age of disinformation, it's a matter of the communication policy, whether we choose of the communication approach, I would say, or the crisis communication plan, whether we choose to respond to any misinformation campaigns that might be launched by the attacker, by another malicious actor, or just by the, let's say, by the internet. This is something that we need to consider because it's an endless loop of whether we keep on answering to questions, because it might affect also the confidence, which one could argue that even if we don't answer to any such questions, it could also affect the confidence. However, one of the concerns that we usually forget is about providing or not information to the attackers. So it needs a very balanced approach. My one, let's say, line recommendation would be to keep it simple, keep it realistic in order to provide assurance, but to not provide all the information when the crisis is ongoing. Thank you very much.
Thank you very much. Very informative. Thank you. And also, dear Jessica, let me also ask you to comment regarding the legal and regulatory implications. Can you please let us know what legal obligations does a healthcare provider or facility have in the event of ransomware attack? I understand
Yes.
legal regulatory framework could be different from different countries, but I think in this area there should be some similarities.
Yes, was the point that I will address. So I can talk about Portugal and European Union because we are under the same regulations, more or less. But one thing that I want to point out before is a ransomware attack that was affected. So something is blocked. Is a consequence that already happened in the past. So is not most of the time the initial vector of a ransomware attack is a phishing attack, where someone clicked on the link and after we have the ransomware attack. So it's a consequence that already something happened before. This is only one point out because ransomware attacks are very, very common in the health sector, unfortunately. And I think it's because the maturity level, it's not very high. And it's our work from all of us to address these issues. And this webinar is very important because people is one of the main issues, but is also a big responsible to address this issue and a solution for this kind of cybersecurity attacks. But taking your question about legal and regulatory implications, so we have two big regulations under EU that need to fulfill when we have a ransomware attack. So we have the NIS directive and we have the GDPR. So the NIS directive, if you are an operational physician services institution, so you need to communicate this kind of incidents to your national authority. And so you have different timelines in different member states to communicate that. And depending of the member states, they will also help you with the national certs. So I can talk about Portugal. So if we have an attack in a hospital that is considered as operation of essential services, they have 2 hours to notify for the first notification to the National Cybersecurity Center. So they need to communicate that something happened. So they don't need to provide a lot of information because in 2 hours it's impossible. but saying that something is happening and if they need help or not. Because also our National Cybersecurity Center have the national cert and can allocate some capabilities to help the hospitals, because most of them don't have don't have like specialized security teams to address this kind of more complex attacks. Under GDPR, so it's when we have personal data affected. So it's very important to understand the impact, what are the system, etc. Because if we see that is an incident considering under the GDPR, so the hospitals also have a timeline to address and to report to the supervision authorities more or less within 72 hours of becoming aware of the breach. And and of course, we have different requirements that we need to fulfill. So we need to say what are the number of people affected, what are the possible consequences of the breach, etc., etc. And other notification that sometimes we need to fulfill is the notification to the data subject. So it's to the people, so to the people affected. So if it's a system that have personal data, you as a person you should be notified because your data was exfiltration, for example, if is a consequence also in an attack of ransomware. But most of the time, what we also need to consider is, of course, it's a right of the person to receive this kind of information, but we also need to think about how this will be communicated. So Danny and also Prokopius already talk about that, because most of the time people sometimes don't understand well what are saying, and can affect the confidence of the hospital or of the systems in that case. And of course, is exceptions to the communication of the patients. For example, if you already implemented the right measures to address the issue that you observed. So but yeah, most of the time the communications that you need to think, it's okay, it's a legal requirement that you have to notify the authorities. If yes, you have timelines to address, otherwise you can have some other issues, financial issues also. And one notification that is also very important, not under the legal framework, is the third-party notification. So it's very, in our case in Portugal, so the hospitals are all connected between themselves. So we have an internal private network. So if one hospital was affected in a ransomware and can affect other hospitals, it's very important that the hospital that suffered the attack communicate to the others in order to block all the connections with the others, because can affect the others and will be a very chaotic scenario, because will not affect not only the internal services, but also the network services of everybody. So as Danny talked, it's very, very important to be prepared for these cases. So we are here talking about the ransomware attack scenario, but most of the times, in most of the answers and the activities that need to be addressed, most of the time, and should be prepared in advance.
Thank you very much. Now we talked about more on the consequences of attack. Now, please, let's also try to discuss a little bit more on preventive actions. And let me ask you questions regarding the preventive measures. Maybe I can start with Dani, and in regard, and related to the governance measurement and healthcare workforce. Danny, if you can please let us know what needs to be done to prevent or mitigate cybersecurity challenges from governance perspective, and how can we empower our healthcare workforce to prevent ransom attacks, basically. Thank you very much.
Right, so we have to, someone asked the question about what would you do to prevent the attack. So you have to assume that these attacks will happen. From Q1 to Q2 2024, the number of attacks globally went up by 20%. There's no evidence that it's going to stop or slow down. So the first thing any hospital needs to do, and I would say when you say a hospital, it could be a network of hospitals or the national CERT, is to do a threat analysis. Now, what's a threat analysis? A threat analysis is to look at four things. You look at what are your key assets. For example, operating rooms are a key asset. Patient records are a key asset. You need to think carefully and ask your CFO how much these assets are worth to you in terms of money. The second thing you do is you ask yourself, what kind of vulnerabilities do these assets have? For example, do you have outpatient clinics who have external internet access? Maybe that's a way in. The famous Target attack on the Target stores in the US about 10 years ago was done through the air conditioning system. So when you say, do I have vulnerabilities? Maybe, well, every hospital in the world has heat and air conditioning. Now, maybe hackers can get in through the air conditioning system. The third part is to understand what threats are really plausible. So we talk a lot about phishing, but there's other attack vectors as well. For example, a lot of hospitals use RDP, Windows Remote Desktop Protocol, and a lot of hospitals have sort of taken Windows defaults of this, which is a very bad idea. So that's another kind of attack. So you can come through, you can have a threat through clicking on things. You can have a threat by coming through remote desktop protocol. The fourth thing, and this is the most fun, is the prioritized countermeasure plan. So really, security countermeasures is like going shopping. There's so many out there. There's so many new things happening all the time. So the first thing, you start with what assets you have and how much they're worth in terms of money. The second thing, what vulnerabilities you have. Can people attack you through malware, through phishing, through targeted phishing? Then you ask yourself, well, what kind of attacks are plausible? And then finally, you go shopping. You say, what do I need to mitigate? And to mitigate things, it's simple things like segmenting the network. For example, if you have intensive care, there will be patient monitors there. Intensive care should never be on the same network as the rest of the hospital. Mitigation is also data backups, but also disaster recovery. Disaster recovery means that if you have critical systems like electronic health record systems in the hospital, you should have a separate disaster recovery system. So you can shut down your production system and switch over in a few minutes or maybe up to an hour to a disaster recovery system for rapid recovery. So that's the kind of things you're looking for. The next thing for governance is to, and this is something which I tell my clients all the time, is that it needs to be owned by the management. So it can't be the kind of thing where the hospital CEO says, oh, my chief information security officer, which I may not have, is responsible for this. I would even go so far as to say that if you and I, Carl, are on the board of a hospital, we should say, guess what, Mr. CEO, your bonus this year is part of achieving objectives on the IRT and preparedness for security attacks. So this should be no less important than how many patients you processed, how many procedures you did, and how much money you brought in. The third part is something which I think, I don't know internationally how well it works, but there in European cases, I think Jessica mentioned this before, there is a national CERT, computer emergency response team. So the national CERT should be involved in all stages here. And finally, and this is the last one, because I'm sort of kind of skeptical about this, which is security awareness training for employees. So security awareness training is okay, but there's one more thing you can do, which is called an acceptable use procedure, which is a one-page procedure called acceptable use. This is what you can do, and this is what you can't do. One of my clients in the securities trading industry had a very extreme view on this. He said, if you break the AUP, you're fired. And though if I catch someone downloading software from some site, you're terminated without your pension the same day. And that's actually a very good deterrent for employees, because they understand that they should not be doing things. It's not the kind of thing that's recommended. And that means that you sign everyone on the AUP. That means you sign employees, you sign hospital workers, you sign contractors on the AUP. So everybody signs up in the AUP. And that's a really simple thing. It's a one-page procedure, which tells you basically the 10 commandments of say, responsible conduct on the hospital network and in general. And that actually turns out to be a very good training tool as well, because then people understand that my salary, my career is on the line because I signed the AUP. I'll finish with one thing, conclude with one thing, which is the Andy Grove, who was the CEO of Intel, said, a little fear in the workplace is not a bad thing.
Thank you very much, Danny. It was very informative. And Jessica, regarding the security operations, what need to be done from the cybersecurity management and security operations perspective? Can you elaborate a little bit more on this?
Yeah, I think Danny already talked about that, but I think it's very essential that the organizations have regular backups. So I am talking about operational level, as you answered. So it's very important to have regular backups, because if something happened, you can store them in a secure way, and it's very important to be off network locations. So please make sure that you have backups, but the backups are safe also. The endpoint protection is also very, very important. So as Prokopius said, 90% of the incidents are human errors or human activity. So it's very important to use some protection in the endpoints in order to detect and block different kind of attacks and to not compromise the network. And in this, it's also important, the network segregation and segmentation. So make sure that you have your network safely and that you isolate the critical systems. So analyze what are the critical systems and networks, and in order to limit the spread of different attacks or compromise your ecosystem. This is not very operational, but I think we didn't talk about that, but it's very important you have vendor and third-party management contract obligations or something like that, because most of the attacks are also from the supply chain, and it's very, very important that you have your protection measures, you have implemented security requirements, but also your supply chain also implement these kind of measures, because they can compromise your ecosystem. And of course, this most of the time it's a contractual obligation that needs to be addressed. I see here a question, maybe at the end or now, since I take the word.
I have one more question for Prokopius, and then
sure.
Still we will have to answer a couple of questions from the auditorium if it's not answered here.
Okay.
So, thank you very much again for your answer. And Prokopius, you already talked about communication when it happens. Yes, when now from a communication or transparency perspective, to prevent this kind of cyber issues, and what is important to consider, basically. Please, can you answer this?
Yes. So from the communication perspective, we can very naively and to put it plainly, we can think of it as preparing for an exam. So we need to practice, get beforehand in the mood where we will be under a lot of pressure and stress, have with us all the required tools, and perhaps a separate a backup pen and bottle of water. So similarly to the communication, as mentioned earlier, we need to also practice this and have, I wouldn't call it standardized approach, but I would perhaps call it a commonly agreed approach. With regards to, let's take the basics, who is the one to draft the communication messages? Who is the one to manage them in order which message is to be communicated to whom? And finally, who is the one to approve the communication messages? Danny spoke a lot about the CEO, so we cannot expect him or her in a time of crisis to be the one taking decisions on the communication messages, on cybersecurity aspects, on issues related to public communication and notifications, regulatory obligations with regards to notify competent authorities, as mentioned by Jessica. So we need to have more or less a good game plan on who does what, without having to go back and forth on agreeing this at the time of the crisis. Now, I mentioned earlier with regards to providing reassurance to the people that might have relatives or might have visited the facility earlier. I spoke earlier about the tone of the messages. So, having performed an analysis and an understanding of what is the key message or the context of the lines to take as they're being called in the communication world beforehand, would have make us already thought about the relatives that they might have, people within the facility, or people that might have their personal health data records already stored in the facility. So having identified all the participants of the context or the stakeholders would be very beneficial. Now, concluding with regards to specifically cyber security, it would be up to the communication plan whether we would like to highlight the fact that, for example, we had all the ISO certifications required by law, or we took them preventively, or this might backfire. So again, I'm coming up to the point where everything has to be thought of beforehand and be part of a plan. Improvisations might prove to be dangerous, because imagine saying, going public and say, look, I have confidence that we'll recover and our systems are secure, since we have already acquired ISO X certification. And then the next day having a very big dump becoming available on the dark web with all the patient's files. This would completely ruin the reputation and the confidence to our institutions, not to take into account the implications, legal or not, with regards to the leak of the data that were breached. Many thanks.
Thank you so much. I can see that we, during the webinar, we had 7 questions. 6 of them are answered. There is one open question. Question is related to how, from Kamua Mwangi. Question is, how about the outsourced security operations centers? Is that consideration for especially large hospitals? I think it's related to the management. Maybe management questions I was addressing to Danny. Maybe Danny can answer this question, or someone else if you want to address this.
Yeah, that's a great question. I mean, there's like a lot of organizations today outsource the SOC. I think Microsoft has a cloud SOC. I saw that recently. I think that like any outsourcing agreement, service levels and responsibility are part of the agreement. So that if you outsource your SOC, that's totally fine. It's a good idea because now you're working with people, that's their job. It's a similar question, by the way, when people said, should I host my systems on premises or should I use the cloud? Well, AWS or Azure or GCP are much better at this than you. They have full-time security people. They're highly trained. They're up to speed. They see 1,000 times more attacks than you will ever see in your lifetime. So outsourcing SOC is a good idea, but I think from a contractual perspective, you need to make sure, and when I say you, that means really 3 people, the CEO, the security officer, IT person, and finally legal need to make sure that the responsibilities that are detailed in the outsourcing agreement are correctly addressed. If you do that, then you, of course, you need to find a good outsourcing provider for your SOC as well. And that's just a couple of guys in the Ukraine who decided to set up shop yesterday.
Thank you. Thank you so much, Danny. We have 3 minutes left, and as we are close to the end of the webinar, let me to highlight a couple of points related to the preventive measures. So this includes implementing robust cybersecurity, legal, regulatory policy frameworks, regularly update softwares and systems, conducting frequently security audits and testing, training employees on recognizing and responding to the phishing attempts, and ensuring regular data backups and security storage and being compliant in general. So many thanks again to all participants, and special thanks and applause for our speakers. It was really informative and interesting session for me, and I hope you also enjoyed this webinar. Thank you all again. I know that the time was very short, but we will continue our work on this direction and hope we can organize more webinars on these topics, and all questions will be addressed over the time. Currently, we are expecting to publish WHO guide for cybersecurity assessment in digital health, and most probably we will organize next webinar on these topics when the instrument is published, to introduce it and as well as to discuss the other relevant topics and issues in this area. Thank you all for now, and we are right on time, and thank you again and have a great day.